Thank you, Sabas. This is working. Okay, and so I'm going to go over what the IAEA does. And first, here you have an outline of my presentation. So I'm going to start off who we are, and you can see in this diagram what the IAEA is part of, is an organization of the United Nations system, United Nations family, is what we call an intergovernmental organization, similar to the International Monetary Fund. You can see with the red arrow where the IAEA is located, and the World Bank. So we are part of the UN, official UN organization, and it's well known worldwide from the safeguards point of view. But as the director Yukiya Amano is very well mentioning in a speech back to 2010, he is trying to change the widespread perception of the agency as simply the world's nuclear watchdog, because it does not do justice to our extensive activities in other areas, especially nuclear energy, nuclear applications, and technical cooperation, which is, you know, the IAEA does much more than basically having these inspectors in some countries. And as I mentioned, CERS is an independent, intergovernmental, and a science and technology organization that serves as the global focal point for nuclear cooperation. It was set up in 1957 as the World's Atom for Peace Organization, and the agency works with member states, with a long list of member states and multiple partners worldwide to promote safe, secure, and peaceful use of nuclear technologies. That's the goal of the IAEA. You have here the list of member states, which is increasing. We have 166. There were a few additional members that joined later this year. So currently 166 member states. The objective of the IAEA is to accelerate and enlarge the contribution of atomic energy to health, peace, and prosperity throughout the world. And the IAEA is organized following this structure. As you can see in the slide, we have 6 different departments, and I work in the Department of Nuclear Sciences and Applications in close collaboration with the Department of Technical Cooperation. The Technical Cooperation Department is the department that reaches out to member states in multiple different projects. So what exactly do we do? Well, assist member states in the context of social and economic goals, in planning for and using nuclear science and technology for various peaceful purposes, including human health, among generation of electricity, also environment, water, food, and agriculture, and production of radioisotopes. So we have multiple different endeavors. The objective of the Division of Human Health is to enhance the capability of member states to address the needs related to the prevention, diagnosis, and treatment of health-related problems through the application of nuclear techniques. The Department of Technical Cooperation, the Department of Nuclear Applications has 2 divisions, the Division of Human Health and the Division of Physical and Chemical Sciences. And the Division of Human Health, what we call NAHU, has in itself 4 sections, and you can see here the organigram of the Division of Human Health. We have the Nuclear Medicine and Diagnostic Imaging section, where I work, the Applied Radiation Biology and Radiotherapy section, the Dosimetry and Medical Physics section, and the Nutritional and Health-Related Environmental Studies section. And we all collaborate together in the Division of Human Health. So what is the goal of the Nuclear Medicine and Diagnostic Imaging section? Is to enhance the capability of member states through basically enhancing safety and quality of practice. And how do we work? Well, we have first to assess what are the needs of the member states. So, because we need to tailor to the specific needs of different countries, and we get to know what are those needs through different means, and you have here the different tools that we have to do that. We have what we call the country program frameworks, which are a detailed official document elaborated by the country, by the member states, in collaboration with the IAEA, which specifies what are the specific problems and needs of every member state in regard to nuclear applications and nuclear sciences. Then we also make use of what we call the NUNDAP, the Nuclear Medicine Database, which is a voluntary database where we record the information from nuclear medicine departments worldwide, and which is updated regularly, and we use this NUNDAP to assess what is the specific situation in a country or in a region, and determine what could be the needs. Also, we make use of UN reports like the Global Action Plan for Prevention and Control of Non-Communicable Diseases, and also we make use of advice from experts worldwide in different meetings and symposiums. We speak with the counterparts, and we get to know what are the situation of different member states. So we use all these different tools to assess what are the specific needs. But we have to face some challenges. And like many things in life, we have lights and shadows. What are the lights of the challenges? Well, we know that medical imaging technology has revolutionized healthcare over the past 30 years. So this is very important. Allows early diagnosis of disease, has the potential to improve the patient outcome, and is regarded by prestigious journals as one of the top medical developments for the past millennium. But at the same time, we have to face challenges and difficulties. And what are those challenges and difficulties that we need to overcome in our work? Well, sometimes it's difficult to cope with training needs of the involved multidisciplinary team of professionals. As by nature, nuclear medicine has the need to collaborate with a multidisciplinary team of professionals like physicians, medical physicists, radiographers, radiochemists, and this can make the training needs more complex. Then there is a lack of proper assessment of the impact of introducing novel high-cost health technology and their sustainability. The information is slowly coming, but still there is a lot of information that needs to be developed in order to justify this high-end expensive technology. And talking about technology, modern equipment can be very expensive, and that's also a limitation for some countries. And also, this expensive equipment can increase the overall cost of healthcare if not appropriately used following specific guidelines. Also, another challenge is equitable access of all patients, and in all countries. You can see that nuclear medicine and diagnostic imaging in general is very heterogeneous in the distribution and availability in not only in a continent, but also in a country itself. Some areas of the country may be much better served than others, so it's very heterogeneous availability of nuclear medicine. And that's also a problem. And then also, all this can make very difficult to comply with international standards, in particular in low middle income countries, due to the lack of adequate infrastructure, equipment, and quality assurance culture, and qualify adequate numbers of qualified professionals, which can limit following these international standards. So there are some challenges that need to overcome, and it's important to acknowledge at the time of implementing different projects. So how do we outreach to the member states? Well, we try to establish a road to the member states, and we help build this road in nuclear medicine and diagnostic imaging, basically emphasizing safety and quality of practice. And we do it step by step. It's a long process, sometimes very challenging, but we try to achieve success helping member states in this process. And we focus in two main areas. We have two main programmatic areas of activity. One is the diagnosis and therapy of non-communicable diseases using nuclear techniques. And the other important program that we are involved with is in educational resources for use of nuclear techniques in human health. And we have four major mechanisms of support to improve healthcare through nuclear medicine and diagnostic imaging. We do it through service, quality, education, and research. And in regards to service, we provide advice and support every step of the way. The IAEA has a well-established function globally in providing technical guidance in the use of nuclear techniques. And here you have a picture of my colleagues, Dr. Enrique Estrada, Dr. Thomas Pascual, the section head, Dr. Diana Paez, and my colleague also, Dr. Ravi Kashyap. And the five of us work together to implement all these different programs and projects. So the service, we provide counseling in all stages of the implementation of the project, from making the case, analyzing the project, to planning and setting up the program, establishing also safety standards. We help providing clinical applications. In quality management, we have the Quantum, and also we facilitate research with many member states. And talking about quality, we all know that is very essential for effective delivery of healthcare. The goal is to assist member states to improve the quality of service they provide in nuclear medicine and diagnostic imaging. Specifically, talking about nuclear medicine, we have Quantum, which means the means is to help member states in quality management systems. And we do audits, clinical audits in different member states, and we have done more than 20 audits in more than 17 countries over the last few years. And here you have one of the audits I had last year. I participated in last year in a hospital in the Persian Gulf, and with a team of professionals composed of a nuclear medicine doctor, a medical physicist, a radiopharmacist, and a nuclear medicine technologist, and each one of us assessed in detail the performance regarding safety and quality of practice of the nuclear medicine department. We spent 5 days reviewing the activities and the protocols and the SOPs of the nuclear medicine department, and we elaborate a detailed report that then we provide with a list of suggestions and recommendations to the counterpart. We also participate, we do research through what we call CRPs, Coordinated Research Projects, which is a way of bringing together researchers from both developing and industrialized countries to solve a problem of common interest, and it has several benefits. It allows participating in multinational research, improves routine clinical practice, and can provide the answer to a relevant scientific question. So we have a list of CRPs in different areas of nuclear medicine and diagnostic imaging, including nuclear cardiology. You have the list here in this slide. Oncology, other topics like infection imaging, and I'm going to start a CRP on neurodegenerative diseases next year, and we have other that will be starting in breast cancer imaging. So we have an ongoing list of coordinated research projects with multiple member states. An important area of our activities is education, and the goal is to contribute to capacity building in nuclear medicine and diagnostic imaging through effective education and training programs based on sound educational principles, and in order to develop competencies in professionals involved in the practice of nuclear medicine through a lifelong learning process. And we do this by different means, through seminars and workshops. We have international conference, regional conference, like this regional training course, for instance. We provide teaching materials, to professionals worldwide. We have technical and scientific publications, an ongoing list and growing list of scientific publications, and then we provide online training. And talking about training, we have this distant assistant training called DATOL online, which is an online training for, initially was developed for nuclear medicine technologies, but the quality is good enough to allow training of nuclear medicine professionals, nuclear medicine physicians. It provides competency-based online program with more than 40 subjects divided in 16 modules, which represents more than 900 hours of study. It has two parts, part one, which is basic science, and then part two includes SPECT and PCT and cyclotron. It has been adopted by some professional societies in some countries in Latin America and Asia, and some university hospitals, and they are the ones who deliver the certificate after successful completion of this online program. So we also provide support on CT and PCT training with partnering with professional organizations like the SNMI, and we have been able to facilitate this training to 600 nuclear medicine physicians and radiologists in member states after reviewing this program, which included the review of 200 CT and PCT cases online. And an important area of educational activities is focused on online training through the use of the IAEA Human Health Campus. And this Human Health Campus includes training in nuclear medicine, radiopharmacy, radiation oncology, medical physics, for technologies, and nutrition, as you can see in the different tabs in the upper part of the web page. And we provide, through these techniques, through this online training, support to member states to strengthen and improve the quality of practice. We are constantly updating, and lately we have been concentrating in developing these e-learning models like this one that I am showing now, of live node stations, different live node stations, which can be very helpful at the time of interpretation of hybrid imaging. And we aim to provide support in a structured manner. It's available not only on desktop computers, but it's available on mobile platforms, cell phones. Can be used to access this IAEA Human Health Campus. And we are constantly updating. We provide new materials and support. As you can see, we are tape recording, video recording this regional training course, and in the near future, it will be uploaded into the Human Health Campus. So our colleagues that have not been able to come here will be able to access this information. One of the latest platforms that we included in the Human Health Campus is this quality assurance program for SPECT systems, which is a detailed program developed by medical physicists. In addition to that, we have a series of webinars, live webinars. We have two current ones going on, one of CT for the nuclear medicine professionals, especially looking into improve the interpretation of hybrid imaging, and then we have another running seminar of series of webinars on nuclear cardiology. We also are involved in hosting different conferences and CME activities. You have here in the lower part the different international conference that we have been organizing. The latest one was IPET 2015 in October this year, with the participation of close to 500 participants from 95 countries. We also developed a long list of scientific and technical publications with constantly new incorporations into the list of publications. One of the latest one is an atlas of PCT in oncology. And last but not least, because it's very important, I'm going to talk about the Technical Cooperation Program. And it aims it's aimed at technology transfer to the member states. It works in a biannual cycle, and on the basis of proposals for this project sent by member states. So it's not us telling the member state, it's the member state telling us what are their needs. It's evaluated by the Technical Cooperation Department and also by different technical divisions, the feasibility of doing this project. And projects in human health represents a significant percentage, up to 25% of the total TC budget. And for nuclear medicine and diagnostic imaging section, this can be up to $3.5 million per year. And you have here a map with the color-coded many different countries that are being involved in human health technical cooperation projects, with more than 60 national projects in 15 regional projects. And one important area of these technical cooperation projects is on hybrid imaging, PET-CT and SPECT-CT, which is in high demand. We have 30 projects with member states. Close to 40% of our projects are devoted to the implementation of PET-CT. And we have 7 projects with member states devoted to the implementation of SPECT-CT. So the technical cooperation activity has represented over the last 50 years that we have trained 2,300 fellowships, and scientific visits have been awarded, which is 950 years of training if you sum all this. And over these years, we have provided close to 290 regional and inter-regional training courses, typically 5 days each, like this one, on different topics related to nuclear medicine, with a total of 4,758 participants. In addition to that, we have supported the procurement of nearly 60 new SPECT cameras to member states in the last 10 years, including everything that you need in a nuclear medicine department. Those calibrators, laminar flow hoods, everything, generators and call kits. So, and we are constantly supporting many member states in this regard. In conclusion, as you were able to see, the IAEA provides support to the member states through technical cooperation projects, by the use of the Human Health Campus, in regards to safety in nuclear medicine departments, through the use of the quantum tool, with distant assistant learning, with the use of the database, through webinars, publications, online trainings, and research. Thank you very much.